So I've got some cases that I want to show some colleagues and get their opinions on. I was drawn to medicine because I wanted to take care of patients and understand the human body more. This is my cancer. It was only a couple weeks after I sort of took over the breast pathology service, and I had just had Henry, my son, that I had my own diagnosis of a HER2 positive invasive breast cancer. So I wanted to know how I was going to survive it. I guess that's a picture of me then. It was a very surreal experience. I remember first realizing, okay, I'm about to go down the pathway that all of the patients I diagnose, go down. So the tissue sample will go into this little cassette. So this is our frozen section room where all of our intraoperative consultations take place for a surgeon in the operating room. They're usually asking a question like, what is it and did we get it out? A HER2 positive cancer is an aggressive subtype of breast cancer. So this protein is positive for HER2 overexpression, which means you have to treat it aggressively. Usually chemotherapy is required. Breast biopsy. I remember meeting with my clinical team and them saying, you could be cured. This Herceptin, the HER2 targeted drug, could be a game changer. It's a HER2 positive DCIS. So I was very excited that I could get this additional new drug that's, specifically targeted to my cancer type. And by the time I had my surgery and the final pathology, there was no cancer left at all. It was gone. So these are some of our residents and fellows. The work that's being done in creating those standards so that the right patients are being treated with the right drug. This is Dr. Jae-Yu Lin. She was my first breast pathology fellow, one of two.
I learned from the best. It's a great era of precision medicine. By utilizing molecular pathology, now we can even further classify cancer into the one that will respond to different kind of targeted therapy.
The more we study cancers, the more we realize how unique they are. And so in the future, I think we're going to realize how personalized we may need to get, and we're only getting better and better at that. Who's home? I think everybody's home. I was so lucky. He was my baby when I went through my cancer diagnosis. I was a patient who was likely to die of metastatic disease at a young age, and then suddenly I'm cured. This was the day I shaved my hair. I remember I was a big success story for personalized medicine, and it brings a lot of meaning to what I do every day. Okay.